Well, thank you so much for having me. And yeah, we're going to talk for maybe 25-ish minutes, and then we'll have some Q&A and open discussion. Like Amanda said, if you have any questions throughout, feel free to put them in the chat to Amanda, and she can filter them to me, and we'll kind of go from there. Yes, so today we're going to be talking about occupational therapy's role, just in general, and then what is OT's role within FND / what can and should it be. We'll explore the sensory and nervous systems and highlight, I don't know why we're kind of changing, highlight how we utilize routines that we already are engaging in from our day-to-day as part of our recovery or therapy. And then we'll put it all together. But before we kind of get started, one of the things that I like to do is what I call a mind-body check-in. So wherever you are, I want you to find a position that you can tolerate for 1 minute. So feet flat on the ground if we're sitting, and we're going to focus on taking slow, deep breaths. And I'm going to guide you through just a 1 minute kind of head to toe check-in for our body. So I want you to see, are we feeling any tension? Are we feeling any tightness? Where does our mind go during this? All right. You can turn off your camera if you want to, or you can keep it on. So we're going to just turn our head side to side. Do it 1 or 2 times. And everything's nice and slow. We're going to go ear to our shoulder. And the goal of this is just to kind of warm our mind and our body up. Roll our shoulders forward. This is usually the awkward movement. We'll just get our shoulders kind of going. And then we'll get our arms back a little bit. And if we can, we'll raise our arms up. Wiggle our fingers. Bring them back down. Get some rotation on our trunk. We'll go one side. We're not trying to pop our back. We're just trying to get some movement. Then you go the other way. And while we're sitting, still focusing on our breath, we're going to do some little marches with our legs. If we're not able to do this, we're going to focus on our breath. And we're going to do some like kickouts. So we're going to straighten our knee. If we can do it a little bit, that's wonderful. Bend our ankles up and down. And we'll wiggle our toes some. I'm going to take a few deep breaths. And one more. Awesome. Thank you for doing that with me. I do that with a lot of my patients because, one, if we don't know how our body's feeling, we don't know where our mind is, it's hard to know how we can proactively help support ourselves and our symptoms and our engagement in our preferred occupations, which we'll talk about shortly. So having a sense of awareness of where we are is really, really helpful. And this is a good practice that I sometimes will start my sessions for. So as we're getting going, I wanted to, sorry, my slides keep just kind of going forward. I wanted to highlight one of the things a website, neurosymptoms.org, talks about regarding FND treatment. I'm sure most of you have heard of neurosymptoms.org, but the way that they highlight FND treatment, the focus should be is a treatment for FND should focus on understanding and managing symptoms, improving physical functioning and movement, and addressing personalized psychological and social factors affecting FND / the person, right? The funny thing is, occupational therapists do this as our foundation. This is not a new or change to how we provide care. I think the difference is, do we have awareness of FND, right? So as we'll talk through this, kind of keeping this in mind, that this is part of our focus area as we are helping those with FND. So what is occupational therapy, you might ask? Thank you for asking. We help people regain or re-engage in their occupations and helping them regain that independence through personalized function-focused task engagement. So this image on the side is a list of a bunch of different occupations that we all engage in. Some we engage in more, some we engage in less, but knowing that there's a variety of tasks that we engage in from day to day that differs from person to person, it allows us to have treatment be personalized to who we are helping. And so utilizing a function-focused or occupation-based approach allows us to not only improve symptoms, but improve engagement in our functional tasks, which I think is the primary focus, or should be, of what we're doing in therapy. And we do this through using a biopsychosocial focus. And I'm sure most of you have heard of that before. But what that's really saying is we're using physical interventions. So we're promoting movement, we're promoting change, we're giving sensory inputs or information or supports, which we'll talk about in the next slide or two. We're going to help with psychological interventions. One of the things that's less known is that occupational therapy actually got its start after I think it was World War I, in mental health support for soldiers. And then we realized that occupations were having a decrease in engagement in occupations. And so we kind of molded from that mental health to more of a function-focused practitioner. And so within that, we're also looking at like lifestyle interventions. So what are those routines that we engage in? How are we integrating things that are helpful into our day-to-day? And so we talked about occupations. I'm going to outline that a little bit more for you. So really, an occupation is any daily task that we need to do, want to do, or are expected to do that brings meaning to our life. That is super vague, right? That is literally everything. When most of you probably hear the term occupation, you think your job. I work in youth and young adults, and so I often have to tell the parents of my patients that I am not here to get your 14-year-old a job, though I can help you with those skills. And occupation are things that we engage in at all times, right? Me talking to you right now, you sitting and listening to me, thank you for being here, is an occupation, right? We are socializing, albeit virtually. And we break occupations into two kind of components. The first one is activities of daily living. So those ADLs, those are hygiene and self-care. Often when people get referred to occupational therapy, this is what they assume we are only going to focus on. Your ability to dress, groom, bathing, toileting, eating, sleep. And while these are very foundational and very core things to what we are all working on daily, this is just a part of us, right? And the next group is the instrumental activities of daily living, those IADLs. This is literally anything else that you do throughout the day. This could be work, it could be school, it could be your hobbies, raising children, socialization, playing sports, you name it. So if we look at each individual through these lenses, it helps us to be able to tailor our care or our treatment. So it's not just giving you exercises, it's giving you, or it's working on intentional tasks that we can help you be more independent with and have strategies to support yourself outside of therapy. And so let's break down now that we know kind of what OT's role is, how are we going to, what is OT's role within FND? So there's three main pillars that we focus on. The first one's being education. We start with kind of what is the role of occupational therapy. So I just did that. Woohoo, step one. Then we're going to go into the diagnosis, right? I'm sure many of you have probably been explained what FND is in a lot of different ways by a lot of different providers. And so it's important that we as therapists have a good understanding of what not only what occupational therapy is, but what FND is, and then what is FND pertaining to the type of symptoms that you have. So we can provide explanations that are personalized to you, not just a cookie cutter analogy that often doesn't make a lot of sense. We also want to talk about what is treatment going to look like? What are we going to work on? Yes, we've talked about occupations, but how do we integrate that into treatment in a way that is meaningful and help you carry those skills over outside of the therapy clinic? And then we want to talk about what are self-management skills. In the next slide, we're going to get into what those are and how we kind of start introducing those into our day-to-day. The next pillar is engaging in those occupations, those daily tasks. So those ADLs, those IADLs, any occupation that we're engaging in. And one of our focuses is we want to make sure that we help you gradually re-engage in those occupations. So for me, with youth and young adults, one of the main occupations that we help people transition back into is school. But if you are having a number of symptoms and sensitivity to light and busy environments, me having you go back there without strategies or supports isn't going to promote a change in our symptoms. And so having supports that allows us to gradually re-engage in those and strategies to know how to manage symptoms or help our body relax in those stressful environments is a starting point. This is also where we talk about adaptive aids, things like wheelchairs, walkers, crutches, shower chairs. I'm sure many of you, if I ask for a show of hands, have probably been told, don't ever use these, right? Which I think is kind of ironic because we say that treatment for FND shouldn't be one size fits all. But when it comes to durable medical equipment, we are one size fits all, right? As an occupational therapist, my focus is for you to be more independent in your occupations. And sometimes that requires us to use supports to help you start engaging in those. I would rather you be able to get up out of that chair or be able to get up out of your bed and engage in a task than take away supports and you not be able to. So I think, once again, another thing that we should highly personalize to individuals. The role of occupational therapy within that is to help kind of come up with a plan collaboratively with you to find out how do we progress off of those supports. Are there moments in your day that we maybe have opportunities to do that? Can we support that within therapy and build in the skills, the confidence, the ability to navigate our world without those aids? And then the third is going to be those self-management planning kind of pillar. And we're going to explore sensory regulation. We'll talk about this in just a bit. We're going to look at nervous system calming, so utilizing a lot of our sensory supports to help calm our nervous system. We're going to look at interoceptive training. So we'll talk about the senses in the next slide, but it's that internal sense of how our body is functioning. Often, these are our warning signs around FND. And then, much like we gradually help you re-engage in occupations, we are going to grade the tasks that we have you engage in. So instead of just having you complete the entire task, we're going to break it up into bite-sized pieces that helps you be successful and be able to practice different support skills safer. All the while, we're introducing activity pacing. I do this a lot with my patients, often somewhat obnoxiously early on, to where we will proactively and purposely pace ourselves just as a reminder for our mind, our body, our nervous system that it is safe and that we have some control in how we can support ourselves during these tasks that we're engaging in. And so when we talk about coping skills or self-management skills, we're going to look at things like sensory regulation. Most of us have been told that there are 5 senses. We've been lied to our entire life. Not okay, right? So we know about sight, we know about hearing, taste, touch, smell, but the 3 that I think are just as important, sometimes even more, is that movement, that vestibular input, the balance, that proprioceptive, that where our body is in space awareness, and then that interoceptive sensory information. So how our internal body is working, right? And so take the fitness of our senses, and we find out what are the things maybe we're more sensitive to, or what are the things that are helpful for us. I'll use things like tactile grounding or smell, like essential oil smells, to help with calming our nervous system when we take our breaks. So what are the good things, the things that are helpful? What are the things that are not? And we take that information and we mold that into our nervous system regulation tests. So in the middle is a handout that I like to give out that are examples of some of these sensory strategies that we can utilize proactively and purposely when we're engaged in our occupations. And often one of the things that I start with when I'm giving education is not just use these when you need them, because if we're having increased symptoms, say we're having functional seizures, in that moment, doing something new is going to be even more stressful. And so we practice these things before we even need them. Often I'll say within our routines, or if you have a transition from a task to another task, let's try a strategy. We're purposefully engaging in these tasks before we need them so we can feel ready when we do need them. And then within that, once we have that information, we integrate that into that activity pacing and that activity grading. So we, like I've said, that proactive restorative breaks. So breaks can be just sitting and taking a breath, but often we look at what does our body and our mind need during those breaks, and what can we use from these strategies to support them. And we're going to listen to those interoceptive signals, which is also kind of counterintuitive to what most of you are probably told regarding your symptoms. I would imagine most of you have been told, don't pay attention to your symptoms, use external focus and focus on other things, and that'll help your symptoms. And while I 100% agree with that to a point, if we don't have awareness of these signs or warning signs or changes in how our body feels and is functioning, it is hard for us to learn how and when to utilize strategies to support ourselves. So initially, having some awareness is helpful. And I utilize things like biofeedback, so like heart rate monitoring, not over like over the top, but just to build some awareness initially so we can utilize these different skills. And then, like I said, we break these tasks, whether we're working on dressing or balance or mobility or whatever it may be, we break them into attainable parts because our brain is really good at remembering successes, and it's really good at remembering stresses, right? It's the extremes. And so when we're retraining or rewiring our body and our mind, we want to replace those extremes with small bits of success to kind of get out of this cycle that we get stuck in with regarding FND. And so as we've talked about kind of using our senses to support our nervous system regulation, it's important to note that most people with FND have some sort of sensory difficulty. I will add an asterisk because most of us as humans have sensory difficulties, right? We just aren't always aware of them. And often with FND, they become heightened. They can become triggering, make different situations tougher. And so if we don't address those, it's hard to help the rest of our mind and our body. And we utilize sensory strategies to help calm our nervous system because a calm nervous system is one that is ready to adapt and learn. Where we are stuck with many of our FND symptoms is our nervous system is overloaded or has so much information that's not communicating between the brain and the body. And if we can do things to allow it to relax some, it's less trying to fight or flight and survive, and more gets into this what we call parasympathetic state, this more like rest and digest and able to learn when we're trying new things, right? So we utilize sensory information to inform our brain to know how it responds to the environment. I'm not going to get too neuroscience-y, but our brain actually utilizes a thing called predictive processing. It takes situations from the past or tasks that we've engaged in, and in the current situation, if it remembers something that's similar, it goes, I responded this way, so I'm going to do that again. So it takes the current information, but uses responses from the past to kind of inform that. And so in therapy, we're replacing those old negative responses with new regulated ones. And so when we have our system that's regulated, it's going to help us to improve our fatigue. It's going to help us improve our pain management just through engaging in more occupations. And that too will also give us more awareness to be able to help manage our symptoms a little bit better. The handout on the side is one that I utilize in my clinic that helps us go through our senses to not only highlight the things that are tough for us, but what also is helpful, because not all senses are bad. And then routines. We're almost at the end, and then we can chat a little bit. So we build in routines into our day, right? We all have a morning routine. We all have a nighttime routine. We have things that we do in between work or socialization or whatever it would be. But routines are great ways to add predictability to our body. And as we just said, the nervous system learns when it's regulated and when it's calm, and it loves the predictability because that is what helps it kind of be regulated and calm. These routines help us build habits, and often these routines are going to be around those more core occupations, those activities of daily living, which are things that are more consistent. Though our symptoms can fluctuate, our routines are things that our body is familiar with, and it makes it a little bit easier for us to personalize them and adapt them depending on how we feel at that moment, how we feel during the day, how is our regulation for our sensory systems and our nervous system, and how does our body feel. And so we can practice these proactive, purposeful pacing tasks and integrating nervous system regulation within these routines to see which helps our body feel relaxed or calm, or feel a little bit more in control. And so we utilize what we currently are doing throughout the day and introduce strategies into that versus have it be another thing that we've added to the day on top of our routines and the occupations that we're engaging in. We do them together. That often ends up helping our ability to be more independent, improve more steadily. So I've said a lot of things. I'm going to wrap it up and then we can kind of chat a little bit. When it comes to self-management or symptom management, I stole this from one of my physical therapy cohorts up in Canada, Hasil Bat. He likes to say we want to recognize our symptoms and strategize what has been helpful in the past. Often when we see symptoms, we start to analyze them and we try to think about what happened and led to this, or did I do something wrong, or is there something that I could have done to stop this? But when we proactively practice these different strategies, we find out, okay, I've responded this way, or I've used this strategy, and this is how my body has responded, right? So we recognize a symptom that might be familiar or slightly different, and we go to our strategies. I want to highlight too that listening to your body's signals is important, right? While hyper-focusing on symptoms can reinforce that loop that can make our symptoms be more prevalent, having an awareness of that sensory information and how that kind of informs our brain functioning will allow us to proactively notice these FND warning signs and utilize strategies to help us continue to engage in our occupations. Routines are unbelievable opportunities for consistency within our day. Though our day and our symptoms can be very variable, our routines are things that we can try to adapt to keep promoting functional task engagement. So a starting point that I usually have is looking at routines, and I see where are opportunities to build in strategies between transitions to help us be able to pace and gradually work our way through. So we don't do this this boom or bust thing where we go until we can't, and then we sort of pay for it afterwards, not because of something that you were doing wrong, but because our nervous system is just overwhelmed and overloaded, right? So we look at our routines, and I would start at morning or sleep hygiene or physical activity. And I know when we hear physical activity, we think working out, but really you sitting up and listening to me is physical activity. You getting up and moving around, putting away groceries, any of these kind of things, that's physical activity. Movement is medicine, but I think purposeful movement is probably more appropriately an adaptation for that saying. And what we do intentionally with repetition is what helps rewire our nervous system. So not just these physical interventions, but also what are we telling ourselves? What are we thinking when we're engaging in tasks? Often we are, as human, critical of ourselves. I know that I am of myself often, and we are really good at highlighting when we don't do something right or when something doesn't go as we thought it would. But we're not as good at highlighting when we've tried something or we succeeded at something or we got a little bit of progress and celebrating that moment, because those end up being bookmarks or flags for our brain to recall, oh, I did something and that felt good, or I was proud of myself. Let's do more of that, right? And then I can't talk to you without mentioning co-regulation as a therapist for those with youth and young adults. But co-regulation is a thing that everyone has and does on a daily basis. And this essentially is the people or the environments that are around us inform or help us or hinder us from being able to regulate. That's why when I am teaching my patients their response plans, or we're working together to create them, I am also engaging with the caregiver and the family to make sure that they know that they have a role, not just to be there, but also be supportive and intentional. Thank you for listening to me. That was a lot of information. Most importantly, like this little dude says, you got this. And I wanted to thank you for listening. And if you guys have any questions or thoughts, please let me know. I'm going to stop sharing these.